What's very exciting that's happening now at Weill Cornell is that we are developing a multidisciplinary esophageal program. We recognize that in the care of patients with esophageal diseases, this is not something that just requires a gastroenterologist. This is something that requires the care of many different physicians, such as a gastroenterologist, an ear, nose, and throat doctor, at times an oncologist, a thoracic surgeon, radiologists, and we bring together all these subspecialties to speak about the patients in total. Many of these patients require many different types of procedures and investigations, and what we do through the esophageal program is when a patient is seen, we meet and we speak about them at a multidisciplinary conference. Their care is discussed, all of their radiology and their pathology is reviewed, and then we're able to come up with an action plan for the patients. What this does is it decreases the time for a patient because we're able to speak about them and realize what do they really need. And then the physicians are able to understand who this patient is even before they're seen in their office. They already have started to come up with an action plan for the patient, and that truly streamlines the care. Through the esophageal program, we've actually opened an esophageal function lab in the institution, and it's a combination effort between surgery as well as gastroenterology. Patients that are seen at the lab have a myriad of gastrointestinal complaints, some of which may be reflux disease, some of which may be difficulty with swallowing. We may be following up on diseases such as achalasia or diseases such as scleroderma. There may be patients who have just chest pain syndromes that we recognize are not related to cardiac disease, that may be related to the GI tract. When a patient is seen at the esophageal function lab, they come to the lab for different types of procedures. Typically, these involve procedures such as esophageal manometry and pH analysis. And these type of procedures, they're actually kind of interesting because typically when a gastroenterologist does procedures, the patients are asleep during the procedures. These procedures, we actually need patients awake, so it's a little bit of a different experience for a patient, and we try very hard to talk them through the procedure and make sure that they feel enormously comfortable with it.